Welcome to another Hot Topics Healthcare interview. Today I'm joined by Lloyd Price, co-founder and chief operating officer at Zesty, the online healthcare appointment booking service that started in 2012 and has now got almost 1 million users. So Lloyd, just tell me a little bit about Zesty.
Thank you, Danny. So Zesty, we started in 2012. The vision was very much to solve the problem of appointment booking. The business was born out of, I guess, frustration and opportunity. So James and I just happened to move house at the same time, and we found it very difficult to get a dentist appointment. And we just sat there together thinking, why is this so difficult? We'd seen in a number of other industries how effectively meta-search, creating and unlocking all the available appointments and displaying it onto almost a price comparison site or a kind of an Expedia type model. So we kind of put our heads together and thought, well, why has this never happened in healthcare? And then the second part of that, which is opportunity, is there's a company in the US called ZocDoc, which is now worth a couple of $1 billion. And I'd heard about them in around about 2009. And I'd followed them, and they grew and grew, and then we started to think, okay, let's have a go and launch this in the UK.
So you come from an e-commerce background and 20 years of experience dealing in different fields. This is your first venture into healthcare?
It is, correct. So yeah, no, I went to uni, came to London in '99, joined a small French startup called Kelku, which became the first price comparison site. We then sold to Yahoo 2004. So while we were there, we did retail, travel, finance, we did automotive. And yeah, then I actually went to Badoo, which is the big sort of social networking dating site, and then ended up in healthcare, which is the sort of 6th or 7th industry that we've come into. But healthcare is really exciting. You know, healthcare is very challenging, very big, and very exciting.
What are the different dynamics in healthcare compared to, say, price comparison websites? Are there similarities?
Yeah, no, very good question. I think the first thing is the sort of information governance, the legal side. You don't really need any professional sort of certificates or authority to effectively start trading online. You could, you know, set up an eBay shop, set up an e-commerce business. Healthcare is very, very different. You need lots of IG, information governance. You need lots of approvals, data protection, you need to register. So I think the first major difference is all the kind of legalities. I think the second major difference in the UK is the uniqueness of our NHS, the uniqueness of our one-payer model. I guess the next big thing is just how big and the sheer scale of healthcare. The fact that it reaches everybody, touches every age group. That certainly surprised us, you know, just the sheer scale of this, which is what makes it such a huge opportunity, which is what we're doing.
I mean, healthcare IT can be a graveyard of dreams and certainly something a drain for any investment. What were the early days like, and what mistakes or challenges did you find along the way that you've learned from?
The early days were like, I think, a lot of early industries. We were going after early adopters. There was a lot of skepticism, a lot of, not criticism, but skepticism. The early days we were kind of obsessed with trust and then kind of delivering. We really wanted people to trust us, and we wanted to deliver stuff, because then that reinforced the trust, and then you start to build. The healthcare kind of IT industry is full of a lot of companies that have in the past made big promises and not delivered a lot. Nothing kind of breaks the trust like signing a contract, not delivering anything. So we're fairly focused on making sure we actually deliver something. James, my co-founder, is very technical. So I think one of the big advantages we've had is building a very flexible system. Certainly with our sort of transition from private to public healthcare, without his kind of skill in building a very flexible IT system, we wouldn't have been able to kind of transition. Some of the other challenges, quite often when you are a startup, you go for these big contracts, and you know they do credit checks and credit scoring, and if you don't have 7 years of trading history, then you effectively can't even apply for the contract. That's another challenge. So you have to work out effectively. You need to partner with somebody. You don't really tend to get that in other industries unless it's major public procurement, like civil service. Certainly, I'd never experienced that in e-commerce or travel or kind of dating or anything other industries. And then sort of another big challenge that I guess we kind of faced is this confusion in the UK about what is free and what is not free. We had quite a lot of users booking appointments with us thinking that it was free when it wasn't. So that's been a challenge as well. I guess that awareness, and then you need to educate people as well. Those are the two things that that we've worked pretty hard to overcome.
Well, the idea has clearly got a lot of traction and is moving forward at some pace. And you've also secured a lot of investment along the way. And I just wondered what that investment means in terms of both the material and psychological ownership of your idea. Do you start to feel that maybe you're losing control or ceding a little bit too much of it at times?
Yeah, it's an interesting question. I think as an entrepreneur, you obviously start the company and you own everything. And then as you go along, you raise venture capital. Venture capital's got a lot of benefits, and it's also got a few drawbacks. You need to understand that you're signing a contract, which is a legally binding document, which is effectively there are a number of conditions to their investment, as long as you understand what you're signing up for. Looking back, I wouldn't have changed anything we've done. I think that to build a healthcare business in the UK, you need money. There's no way you can do this slowly and organically. So wouldn't have changed that. In terms of the control question, I think we've never felt like we've lost control. We felt like there's obviously more of us around the boardroom, and we felt like there's more debate because there's suddenly 3, 4, 5 board members. But overall, that's fairly positive. I wouldn't say it was generally a negative. If I was to do it all over again, I think I would try to take the business as far as we could before needing to raise venture capital, which I think any entrepreneur would tell you. Taking it very early means that you effectively have these conditions as you operate. But yeah, we've learnt a lot from the guys. They're professional investors. Their ability to analyse and segment markets is very good. That's what they do for a living. So there's been a big positive there.
Okay, so it sort of brings us on to the nuts and bolts of Zesty then. Why do you think it works so well and is appealing? I mean, both in terms of the public, for what they can get out of it, but also for health systems which are bogged down by inefficiencies and bureaucracies.
I think it works because it's very simple. I think we're very used to booking things online. I think James and my background in e-commerce means that we view the world as transactional. I go online, I tend to research, and then you want to book things and you want to buy things. So I think in healthcare there's a lot of businesses that kind of are in that sort of information stage or sort of awareness stage. They can help you make a better decision. But people want to do things online. They want to book an appointment, book a prescription. So I think the reason Zesty probably works is because we solve that problem. Again, James, my co-founder, he has a good saying, which is we just remove the friction. You don't need to make 6 phone calls to call Old Street dentist, London Bridge dentist. You just go onto the website, type it in, and then all the appointments show. So I think that idea of removing friction is a big one. I think one of the major steps forward was actually releasing the apps, the iPhone apps. We saw a massive increase in adoption when we launched the iPhone apps. It's just because it's quick and easy and simple. Especially for NHS services. The second thing I think Zesty's worked pretty well is because it's direct access. You don't need any sort of referral from a GP or referral from anybody. If you want to book, for example, a walk-in or a direct access, for example, sexual health or there's other mental health or community health appointments, you can effectively just use Zesty app, book an appointment and go. So I think it's that combination. And then I think that the other point is that we were the first. Back in 2013 and 14, when we launched Zesty in 2013, and then when we released the apps in 2014, I guess there was a slight first mover advantage. So, we got adoption, we got traction, and then I guess people got used to the system, used to the service. Now there are 4 or 5 kind of Zesties. which is a compliment and a competition. But but I think, and I think the other thing as well when we look back is we only focused on one thing, which was booking appointments, solving that problem.
Yeah.
We didn't go into medical records. In 2012-13, it was quantified self, this huge movement. Then we got into wearable tech, and we just, were personally interested in it, but we never got involved in it.
Yeah.
So I think Zesty's probably worked better because we just focused on one thing.
Now the NHS is bogged down by inefficiencies. What are the sort of things that you can take out? That friction, for instance. Have you got any examples of waste or processes that don't quite work?
I don't think there's wastage in the NHS. I think there's opportunity to reduce costs, and I think there's opportunity to lower costs as well. We've worked with a couple of healthcare economists, and they're very much cash releasing and non-cash releasing. They talk quite a lot about reassigning different people to do different tasks. The NHS talks an awful lot about tasks, task management, what everybody's doing. To give you a couple of examples, so if you take an average sized hospital, maybe 500,000 outpatient appointments, that's probably maybe 600,000 letters a year, 2,000 a day. If you add up that amount of money on stamps, there's probably close to £750,000 a year just on stamps. If you add in the envelopes, if you add in all the time, I reckon you probably get to 2 to 2.5 million just to service all of us receiving all of our letters. So if we could just replace that system with an email, something through to your phone, a PDF, then that's a cost saving there. I think the second thing is kind of support. So one of the things that we're focusing quite a lot on at the moment is what we call online triage. So you can, before you make your appointment through the Zesty system, you effectively answer a set of questions, which the information is then fed back into the clinician. That effectively removes the need for a nurse or anyone else to call you sort of 24, 48 hours before your outpatient appointment. And then linked to this sort of notion of online triage, we have pre-visit questionnaires. So instead of a nurse or a clinician scheduling time to call you if you have a particularly complicated case, then you can just self-serve. So I think technology is an enabler, patients self-serve, and then there's a trickle-down economics effect. But the idea you can go in and remove, say, 5 million of cost savings, that's inaccurate to say that. You just effectively make cost savings as you go along.
But there is a point, isn't there, that if we invest in technology, for every pound we invest to bring something new in, we need another pound to actually make the system transform and adapt.
Yeah.
That's quite a tough ask, isn't it?
Yeah, and that's a very, very good point, because I think a lot of people have expectations that you deploy technology or software and then everybody uses it. I think probably the biggest lesson I've learned personally in healthcare is that your user is not your payer, and your payer is not your user. So, for example, all of Zesty's services are used by patients, but our patients don't pay us. Our hospitals, our clinics, our doctors, our dentists, our physiotherapists actually pay us. So there's a little bit of, you've got two masters. You've got to work with and train and educate the people that pay you, and then you've got to train and educate the people that use your product. So what we've seen typically is once you deploy the technology, you've then got to go in and you've got to then train the staff. I can give you a very good example. So in 2013, we were just approached by a guy called Dr. Anatol, who is the lead sexual health clinician down in London Bridge. He'd been looking for a solution to offer online booking. We sort of gave it to him for free. We went in, we trained all of his staff. They adopted to it very quickly. And then, to our surprise, their staff then went to other clinics and trained their staff. And there was a little bit of a knock-on effect. But I guess if we hadn't invested and spent the time training the first sort of clinic, then there wouldn't have been those kind of benefits. But there are an awful lot of questions after you deploy the technology, FAQs, kind of, does this work? Can you change things? I guess one of the traps you fall into being a kind of, an early stage or startup is that everybody wants to slightly bespoke the solution Could it just do this? Could it just change to that? That's very tempting in the early days because you want more customers and you want more clients, but it's quite damaging because in the product roadmap you're constantly having to make tweaks, which means kind of nothing really moves forward because you're always changing things. So on top of your point about £1 of investment there and £1 of investment there, I think as any kind of early stage entrepreneur, be careful there's not another £1 here in this kind of bespoking personalisation pot. Yeah. Because I've seen a lot of people just try to maintain contracts and win contracts by basically over-investing and over-servicing. It's a very fine balance because you know you have to create very good value, but you also have to understand that there's no point in doing a half job for 6 people. You might as well just deliver something for 2 people. Is one of the lessons we've learned as well.
And the NHS is moving forward digitally in quite big strides. What are you seeing that really impresses you, and what are the challenges that the government and Department of Health need to address?
So I think the first thing is to say is that how very proud we are of the NHS. I think the NHS doesn't really get a good voice and representation in the media. I think there's an awful lot of stories out there that don't really cover what innovation is going on. Two good examples recently. There's a piece of technology called a live core, which is a mobile EKG. So effectively you put your 2 fingers onto a little piece of technology like that. There's a mobile phone application and it effectively takes your pulse rate. You can do that 10 times a day, 100 times a day if you want. It's passed, so it's medical grade, so it's passed all of the UK kind of medical barriers. And effectively what it means is that if you monitor your own kind of health over time, if you then share that data with your doctor or share it with your hospital, that could potentially save quite a lot of lives. I think there's other innovation. There's a company called Umotif, which is an app for Parkinson's. So effectively it's behavioural applications. So you do little tests as you go along every day. And again, what you're looking for is the deterioration in your condition. And then if you feed all that data back in, then that's very good. There's a whole host. A company called Babylon is getting a lot of attention at the moment with its chatbots and AI. Personally, I think the battleground will start to become medical records and also kind of authentication and identification. I think a lot of people forget about how does the government give you access to NHS services or health services? How does everybody know you are who you are? And I think that's one thing that a lot of innovation is coming. There's a national system called Verify, which the government has built, which is currently kind of being adopted into healthcare. And then there's a whole host. You could talk all day about the artificial intelligence stuff with Google DeepMind, IBM Watson. It's very exciting. Healthcare is a very big and very exciting industry.
Lloyd Price from Zesty, thank you very much indeed for your time.